I have a question when you were talking about the bicameral and healthcare and Medicaid expansion. Isn't there a petition going around to do that right now? So how would that affect whatever that bicameral task force is?
Do you want that one?
I'm going to jump in here. How about that? I support Medicaid expansion ultimately because I represent Northwest Oklahoma City. Integris Hospital System is located right in the heart of my Senate district, and it is he's in the back of the room, so you can correct me if I'm wrong, but this facility in this location has the second highest number of uncompensated care in the country. This hospital that I represent has the second highest number of uncompensated care in the country. And so if we are going to continue to pretend that we are not currently at crisis levels, we're going to continue to close hospitals at record numbers. I believe 29% of our rural hospitals are poised to close this year because we have not expanded the rate at which we would accept those federal dollars. That to me is unacceptable. As a mother of three who just recently had my third baby, I read a study that came out while I was pregnant with her that basically indicated we have the highest rate of maternal mortality, not only in the country, but higher than third world countries. And from my home, that's hard for me to understand because I can point my finger in any direction and within a 5-minute drive receive the level of care that I know I need. That's not true in most parts of our state. So if we're going to continue to put our head in the sand and not pretend that we are at crisis levels statewide for access to basic continuity of care, an annual exam that doesn't take an entire day off of work to come to Oklahoma City to receive, that's really what we have to look at. I'm from northeastern part of the state. Bartlesville is where I grew up, and so, I mean, even having that frame of reference is by no means the most rural part of our state, but knowing how it impacts, my family who lives in Barnstall, Oklahoma, and the amount of driving that they have to do to receive care, we've got to do more to make sure that our physicians can earn a living and that we're drawing and attracting physicians into those rural areas. And a lot of what that is wrapped up into, obviously, is money and funding. And so if we really want to reinvest back into creating a culture where Oklahoma is putting its citizens first, this is an easy one to me. And I hope that our workforce, our task force, I guess I should say, is open-minded to all avenues and all routes of funding that's going to be necessary in order to make sure that everyone's taken care of.
Isn't there a petition going around? Okay, so it would become a state question okay, very good.